Welcome to Dateline Health. This is Fred Lippman coming to you from Nova Southeastern University. This is the Alan B. Levan Innovation Center, and we're very pleased today to have a person that I experienced by reading some articles about, and this is Dr. Phyllisa DeRoze. She's an advocate, I guess I would say, and an author, and an educator, and a blogger, and it all relates to diabetes. And since we've had so many questions about diabetes, I said, what a perfect person to bring on. So welcome, Dr. DeRoze.
Thank you so much, Dr. Lippman, for having me here today. I'm excited to be here.
Oh, good. Let me just start out by a very primal question, and that is, most people who have diabetes do not recognize they have diabetes until a certain medical condition occurs. So why don't I just throw it out to you?
I'd like to first start off by saying I am Dr. DeRoze, but I have a Ph.D. in English literature, not a medical degree. And it's important that I always say that because I will not be giving you any medical advice. I will always say defer to your medical physicians for that. What I give people is my lived experience. So when you said a lot of people don't know that they have diabetes until there is an issue, a crisis, that's exactly what happened to me. So I was first semester, graduated with my PhD, my first job as a professor. I was so excited, and I started feeling really tired around February. So this goes back to January 2011, me feeling really good, on top of the world. And in February, I started feeling tired. And I would say to a colleague, hey, I'm really tired. And they would say, oh, it's that time of the semester. It's that time of year. And that alone kind of delayed my care seeking a physician. By the time I saw a doctor, not only was I experiencing fatigue, but I was also experiencing frequent urination, extreme thirst, blurred vision, and I also had sweet smelling body odor. Now, this is something that I like to tell people because when I noticed my body odor started to change and it started smelling like cantaloupe and dandelions, I didn't know that it was an issue. And it is. It meant that my blood sugar was so elevated that the sugar was just like expelling out of my body. So that is a symptom of high blood sugar. If you notice your breath or your body odor has a sweet scent to it. And so I went to the doctor. These were my symptoms. Unfortunately for me, my primary care physician did not check my blood sugar. It takes 30 seconds to do that. The primary care didn't do it. What I was told was my symptoms are because I work out a lot and I need to drink Gatorade. Well, what's in Gatorade? Sugar. So I already had elevated sugar. I was told to drink Gatorade. My blood sugar shot up through the roof. I passed out in my bathtub Valentine's Day night. I woke up after being unconscious in the bathtub for I don't know how long. And I went back to the doctor and said, listen, Gatorade is not curing me. Something is wrong. From there to the emergency room where I first heard the words, you have diabetes. And that is how I was diagnosed with diabetes in the hospital, going into a diabetic coma. And I wish I had known the symptoms long before.
Well, what you present in your commentary just now is very, it's so repetitive from many of our viewers that have been kind enough to view us this last 23 years. But we have individuals And it's not necessarily age-related, because we're going to talk about that in just a minute, of the two different types of diabetes, which are age-related in concept. What's interesting is your comment about, not doing any blood tests. I mean, I have always suggested to the people who view us that they have to see their doctors. I would assume, hopefully, that at least a blood draw is done once a year, or once every 2 years, or whatever, because there are many other indicators in the blood system other than the issues of the diabetic function, or I would say attack.
Yeah.
And we talk often about it. We talk it, and we're going to talk a bit about nutrition in a little while. So, but tell me, because in reading the article about you and your daughter, tell me the difference between your diabetes and your daughter's diabetes.
So my daughter does not have diabetes, which was the emphasis for me writing the book. Because when I looked for children's books that I could use to help explain diabetes to my daughter, all of the children's book about diabetes had a child with diabetes. So our book is the first book that allows parents, grandparents, aunts, uncles to talk to the children in their lives about their diabetes. So this idea came to me when my daughter was just 3 years old, and I saw her pick up my reader and scan scan the CGM and look at it and smile. I guess she, in her imaginary world, got a good glucose reading, so she smiled. But what it did was it made me realize that she's learning about diabetes as she's learning about the world. Before she can even complete 2, 3 sentences in a row, diabetes is a part of her world. And I need to talk to her about it, because a lot of times people who are managing diabetes, we don't like our family members to know. We don't want anybody in our business. We don't want to tell people on our job. We keep it to ourselves. And it never occurred to me that I need to talk about diabetes with my daughter. So I was looking for child-friendly language that wasn't scary about diabetes, language that wasn't stigmatizing about diabetes. And because I couldn't find it, we wrote it. And so now she's 7 years old. We spent last year mapping the book out. She had input on the characters, the names, what we do together to help people with diabetes. So in terms of the differences between diabetes, the book has 3 types represented: type 1 diabetes, latent autoimmune diabetes in adults, which is what I have. I'll explain that in a moment, and type 2 diabetes. So people are curious about the types. Our book also provides education on that. Type 1 diabetes is an autoimmune condition, and the body is attacking the beta cells that produce insulin. So people who have type 1 diabetes are going to be dependent on external insulin, buying it from the pharmacy, because the body is attacking the beta cells that produce insulin. People who have type 1 diabetes, it's a very quick onset. They get it, and now they are dependent on external insulin. In my case, I have latent autoimmune diabetes in adults. It is, by all means and purposes, type 1 diabetes. The difference is it's a slow progression to needing external insulin. So it took me about 8 years for my autoimmune condition to just shut down my beta cells. So that's the difference between type 1 and LATA. Quick onset to insulin dependence, slow onset to insulin dependence. And then, of course, there is type 2 diabetes. That is not an autoimmune condition at all. There, if you do blood work, you don't have any antibodies attacking your beta cells. I'd also like to say, in terms of type 1 diabetes, it used to be called juvenile diabetes, but we find that 50% of the people who are being diagnosed with type 1 diabetes now are actually adults. So it can happen at any age. And I've met a few people who are senior citizens and are mature, seasoned lifestyle who have been diagnosed with type 1 diabetes.
The the reason I wanted you to go through that, and by the way, what is the name of the book?
The book is Diabetes Helpers. So they are children who help relatives in their lives with diabetes.
Okay, and I would assume it's available online or on.
Yes, it is available on Amazon.com and you'd be able to get it at Barnes and Nobles as well.
Okay, good. I hope we have it here in our library.
I hope so too.
Uh, I would want to just touch on the issue of diabetes in itself. I would like to get into something that came up more than once relative to nutrition. Uh, and I also want to talk about in a while the effect of being a diabetic and the effect on other organs in the body. So relative to nutrition, do you find, or I don't know whether it's been written in your book, I have no idea, I didn't read the entire book. Do you talk about label reading? Do people literally, when they walk through these wonderful, magnificent supermarkets we have, whether they be the big box stores or the wonderful stores that have been with us for years, do they ever turn the can around and take a look and really see? I mean, it says sugar, but then there's all of a sudden in ingredients, there are some magical names, and I'll leave it to you. So go right ahead, talk about it.
So in terms of nutrition, where I talk about it in the book, remember my goal is kid-friendly language. So I give adults the opportunity to stop at where I stop in the book or to elaborate further. So there is in the book the journey of how do diabetes helpers help the people in their lives. I talk about eating vegetables and carb counting in that section. So Jelana, my daughter, she shares in the story how she helps her mom eat vegetables with every meal. Antonio helps his papi count the plantains on his plate. So if people want to get into carb counting, they're able to explain that further, or if they want to just end it right there. And then Grace, she helps her brother not have too many slices of their mom's chocolate cake. So in terms of just managing the food. But when it comes to food labels, this is where it's vital. If you are diagnosed with diabetes, you need to see a nutritionist and a diabetes educator, because this is the life with diabetes. We see our endocrinologist or a diabetes specialist every 3 months. So that means you are managing your diabetes day in, day out on your own. So you have to know how to do that. And then when you do see your specialist, I mean, how long do you have with your specialist? 30 minutes, 45 if it's, really good. But most people, they're on like a 20-minute time frame. And so reading the back of the labels for carbohydrates is extremely important. If you are taking insulin, you have to give yourself insulin for the amount of carbohydrates you are consuming. So for example, this morning, I have had a piece of toast and some coffee. There's milk in my coffee. One cup of milk is about 15 grams of carbohydrates, and then my toast is 12. So I have to factor those in and give myself insulin for that. When I managed my diabetes, just diet and exercise, no medication, no insulin, I still had to be aware of how many carbohydrates were in the food. So I would say, in terms of label reading, for me, I look first and foremost at carbohydrates. Some people look at calories, but here's a joke, Dr. Litchman. When I was first diagnosed, my endocrinologist said, I want you to count your carbs and count your calories. And I was so overwhelmed. I was like, listen, you're going to get carbs out of me or calories out of me, but you aren't going to get both. And to this day, I still like focus on carbohydrates because it's what I need to give myself insulin. But I definitely applaud people who look at everything. Look at their calories, look at their proteins. Fiber is also very important for people with diabetes. If you have 5 grams of fiber in your food, that's like where you should aim to be. But by all means, see a nutritionist and a diabetes educator and see them frequently. I schedule appointments every year with one because you need to freshen up. Some things you forget and you want to go back to it. I think right before the holidays is an important time because we all want to just live and have fun during the holidays. So I kind of get that like nudge, like this is what I need to do before going into the holidays.
Oh, no question. I mean, you think of the holidays, you think of Valentine's Day with all the candy out there, and then you think of Halloween with all the candy out there. And not that adults are walking around, although there are some adults walking around like that. And then, of course, the intake of spirits and wine and things of that nature. One does not think of them as carbohydrate or sugar products, which they are. As far as children are concerned, I've spoken to, and of course, you being an educator, you know this. The problem that's inherent with children who are athletics, they're running around in their free time. They eat the standardized foods which are presented in the cafeterias, which I know they are overseen by nutritionists and otherwise. But I just wondered what you face when your children, God bless them, face every day when they're not in your hands.
Oh, wow. It's hard. It's difficult. I do want to say this about the labels because it just happened last month. My daughter is now into waffles in the morning, and we had syrup. And I always make sure I get the sugar-free one because then I don't have to give myself as much insulin for the sugar-free syrup. But I was just picking up syrup for her, not paying attention. And so last month I decided to read read the labels. I was so surprised that I'm not naming any names, but please look at your syrup if you buy syrup. It was not syrup. It was like it was the flavoring of maple syrup. And I was like, this is not happening in our home. So I purchased maple syrup and I showed her, I said, look at the ingredients. One had like 10 things on it, and the maple syrup had one maple syrup. And then I talked to her about the price difference. I was like, look at this. This is 239 and this is 569, right? But what's the healthiest one? And so that is how I started educating her too, looking at those labels so that when she is out of my presence at school, at other people's homes, at fun camp, she can read those ingredients because I told her if it has more than 5 ingredients, it's probably not the healthiest thing for you to eat. But the syrup really surprised me. I was stunned by that.
The other thing that has come to us often by our viewers are the issues related to um, the, I would say, the mature. I never say elderly because I'm elderly. But the mature individuals of our community, many people who are living in adult living facilities, et cetera, beautiful, wonderful venues. I just wonder whether there is a desire among the advocates to have the application of products that end up being sugar to be provided to these individuals, because a lot of these individuals are under certain pharmaceutical care through their physicians, and they're not aware of what their intake is. And I'm not saying that anyone is doing it inappropriately. I'm just saying that I think knowledge, I've always said knowledge is the greatest sword that we have in mankind. Many of these individuals are suffering from diabetes.
Yeah. To that I will say, because I love to travel, that is one thing that is dear to my heart. And when I was first diagnosed, I thought, oh my goodness, I'm not going to be able to travel. And now it's not an issue. I just drag diabetes along the way. But I've traveled to 25 countries and lived in three. And being in America, in some places, it's very difficult to get high quality food that is affordable. So when you talk about people who are in assisted living facilities, we also have people who are incarcerated. We also have people in a foster care system. Like when people are in these systems and they can't control their food, it can be very difficult to get access to that. One thing I could say about certain places, Florida has South Florida in particular has a lot of farmers markets. So if you have access to farmers markets, do shop there. I lived in Pennsylvania for a while, and there was a season where the Amish would come down with their fresh goods. So I would always buy whatever I could from the Amish during those certain seasons. So even if you can't get everything when you want it, try to get the healthiest that you can. I find buying my vegetables from the frozen section is healthier than getting the canned foods, because of the preservatives that are in the can are different than what you find in the frozen section. So that is something that we can do. But again, systematically, it's just difficult. So we have to be able to do what we can. Just take one step. Just decide when it's potato season, I'm going to buy potatoes from a farmer's market, right? When it's broccoli season, I'm going to buy that, and trying to buy things that are in season. My mom and my grandmother have mango trees in their backyard. So I try not to buy mangoes from the grocery store. So I eat them in season from their tree or neighbors. Same thing with avocados. I try to purchase those in season as well. But I just want to encourage people, these are little steps, but they make a big difference. So don't feel overwhelmed by it. Just focus on the little thing that you can do and be proud that you are making that small step to eat healthier and to be healthier.
We're down to the last 1.5 minutes of the show. It's really flown by, and I thank you very, very much, not only as an author and an advocate, but also as an educator and a blogger and an individual who's presenting information not for adoration, but for purposes of helping other people. And I salute you. What is the name of your book again?
The book is Diabetes Helpers, and you can find it on Amazon. And my blog is diagnosenotdefeated.com. Again, diagnosenotdefeated.com is my blog.
I'll have that up on our screen for you. I thank you very much, Phyllisa DeRoze. That's a very interesting spelling of your first name, but it's obviously from your background, but I have an interesting extra initial in my name too, so I understand it. But thank you very, very much. We appreciate your beliefs, your feelings, your humanity, and I hope that at some point in time we get to see you here in our library and offer some opportunity to present knowledge to perhaps one of our groups. So thank you once again for being here today. Thank you.
Thank you for having me.
Quite welcome. Thank you, folks, for showing up again this week. Remember, I always tell you, you have to talk to your physicians. Don't take it upon yourself to let a little something that, oh, it's bothering me, or I don't understand why, or as Dr. DeRoze was saying, you know, a simple thing like a sweet body odor. Talk to your doctor. Your doctor's there, they're your friends, they're your neighbors. Let them help out. Anyway, this show is called Dateline Health. We come to you from Nova Southeastern University. My name is Fred Lippman. Until next time, see you.